Hello, could you confirm, Kylie, that you can hear me?
I can hear you.
Great. More people are signing in now. Okay, let me begin by stating I have all the labs graded now for both the first and the second time. I have all the lecture worksheets graded as well. Let's see. I'm not sharing my screen so I can take a look at the grade book. I have all of the, what is that called? The extra credit study sheets graded. I have the preliminary quiz graded as well. I didn't realize I hadn't got that graded. The what was that called? The practice quiz. One is graded. Quiz 1 through 5. I have viewed the what is that called? The environmental scan. And if you didn't do an environmental scan, I gave you a fairly nasty note telling you I would spend time when I have time looking at the entire recording to see if your eyes ever left the monitor. And if they do leave the monitor, I would assume you're reading something off to the side to cheat. I haven't had time to do that yet, and I'll try and let you know when I do that. I think I have that for quiz 5 and quiz 4, and maybe even for quiz 3 as well, where I have to take a look at all of the recordings for the students who did not give me a complete environmental scan. And I'm not sure when I'm going to have time to do that. It probably will be after the final. I have the final set up now. Both final A and final B are now set up. Final B is the multiple choice questions, and it was always set up, but I think I've got it set up now. Let me check on that. So that the environmental scan will be happening on question 1. I've turned off the, I don't know, environmental scan before the exam. I want it during the exam. The reason being is that it doesn't record in between when you do the environmental scan and when you start the exam. And so I want it to be all in one set. That's why I have it moved question 1. And I ask you, have you shown me the environmental scan? Do it now. And then I ask, have you done it now? And I give you more time to do the environmental scan during the exam. And I state that all in question 1. So please answer the question correctly. If you do the environmental scan and it's the complete scan, I will give you 3 points of credit for question 1. If, on the other hand, you do not give me the environmental scan, you'll get 0 points on question 1. And it doesn't matter what you state for your answer, because I'll go in and simply change the score if you don't give me an environmental scan. But let me check on, make sure I've got that set up. Yeah, the environmental check is turned off for final B. So you have to give it to me on question 1. And I have done that for all the quizzes, by the way. It's just that 2 of the quizzes, it did not keep my settings. For some reason, when I went in and changed the setting, it never took. And I'm not sure what's going on. But I did get an email saying the canvas wasn't quite working correctly, and it has something to do with, I think, the Windows 11. We recently went to Windows 11, and so Canvas wasn't quite working correctly. And let me check on Final A now, and it should be the same. I'm just double checking to make sure I've got the environmental scan turned off. And Canvas isn't still quite working right. I've got to click on the box and then scroll down on the page. I can't scroll down with the mouse. Let's see, right here it is. Yeah, the environmental check is turned off there also. So, and I went in and changed the questions for final AA. Now it is multiple, what do you call it? It is a short sentence answer, but most of the questions, not all the questions, I made it a short sentence answer and multiple choice. And some of them you do need to fill in the blank or fill in an answer. And but some of them it'll be not a one word answer, but it'll be a sentence answer, and you have to choose which sentence. For final A, because it's going to be either essay or short answer, and then you're going to be looking up tables. I'm giving you, I think, 46 minutes for the exam, and there's only something like 4 questions. You do need to use both the lockdown browser and the webcam for both Final A and Final B. Any questions about any of the finals or anything I've discussed? No questions. Let's move on. Let me get out of the grade book and then I'll share my screen. And as you notice, the camera on my computer is not working. I'll have to take it in and have them look at it. I did at one point, using this new computer, turn off the camera, and it was working for that session. It wasn't a class I was teaching. It was a class I was taking, and I turned off the camera after getting it on, and I have a feeling it's stayed off, and I'm not sure what the problem is. But I don't think I'll need showing you my face, because when I share my screen, you should get that. Oh gosh, there's a different share screen here. Just a minute. Yeah, there's a normal share screen. There we go. All right, you should be seeing my screen now. Any questions? If not, let's get to it. We were on chapter 14. I've got that we were here, but the the computer is telling me that I was here. So which slide did I end up? Have I talked about incidence and prevalence? Have I talked about communicable diseases, contagious diseases?
No.
All right, so I am on chapter 14, where I did talk about Koch's postulate, correct?
Yes.
All right. All right, let me state that there are some exceptions to Koch's postulates. Remember, Koch's postulates are the steps microbiologists use to show that a given organism causes a given disease. But there are some exceptions to Koch's postulates, like what do you do with microbes which have unique culture requirements, meaning they cannot be cultured in vitro? And an example of that, for over 100 years, people were trying to get Oh gosh, let me see what its name is. Palindrome. Treponema palindrome, the bacteria that causes syphilis to grow in vitro. And they could not, for over 100 years, figure out what they needed to supply to get it to grow. Recently, within the last 10 years, they finally figured out what you need to add to the media to get it to grow. But for 100 years, were not able to get this organism to grow. And yet people did know that Treponema pallidum did cause syphilis. Another one, which I haven't looked up to see if anyone's figured out what it uh, requires to grow, meaning maybe they've recently required it, but for practically 100 years, uh, they never figured out how Bartonella henselae, which causes cat scratch fever, they never figured out for over 100 years what you need to add to the media to get it to grow. And as far as I know, I mean, I haven't looked recently, but they may not have figured out what you need to add to the media to get this one to grow. There are also multiple organisms that can cause the same disease, signs, and symptoms. I mentioned that with the human cold, not only are there multiple species of virus that cause the human cold, but there's actually 3 families of virus that cause the human colds. And in Koch's postulate, you can only have one organism causing a given disease. So how do we know that these different viral species cause the human cold if in Koch's postulates you can only have one causing a given disease? And then there's some species which cause different disease conditions, like Salmonella. I think it's more than one Salmonella, but Salmonella typhi can cause salmonellosis, which is a gastrointestinal disease, but it can also cause, oh gosh, let me see what this name is. Is it typhoid fever? Can anyone verify that? Let me do a search here. Yeah, it's typhoid fever. Now I know because they used to call it Typhoid Mary, the lady who was um, a cook and she was spreading typhoid fever around because she was a carrier of salmonella. Yep. So what do you do when one bacteria like salmonella causes more than one disease? Where am I? Right there. I think I need to start sharing again. Remember in Koch's postulate, one species can only cause one disease. So there are some exceptions. And how do we know that, well, there's some moral and ethical conditions for human-only disease. Like, how do we know that HIV causes the human disease AIDS? Has anyone ever injected a patient with HIV virus and then later checked them and found that they had AIDS? That would be a moral and ethical reason not to do that. And I can tell you, no one's ever purposely injected HIV into a patient and then later discovered they got AIDS. So, how do we know that all these different exceptions to Koch's postulate are caused by one species? Like one species of virus causes uh, human colds, but there's multiple species, multiple families that cause the human cold. How do we know that? How do we know that HIV causes AIDS. Anyone have a guess? Nobody's going to even take a guess? Well, what you do is you take vast epidemiological studies. For example, they took vast populations of people in the city of San Francisco initially, but later on across the entire United States, checking the people who were HIV negative, following them over time, and noticed some becoming HIV positive on their own, and then following them over time and finding that only patients who were initially HIV positive developed later AIDS. And you can do that with the colds too, the viruses causing colds. Certain species can cause the human cold. And then you can do that with salmonella. Follow patients who come down with salmonella infection in the intestines, and then looking to see if they develop salmonellosis or typhoid fever. Any questions about any of that? All right. A symptom is a change in the body function that is experienced by a person as a result of a disease, but it is subjective, something that is not apparent to any observer, meaning you cannot measure a symptom. A good example of a symptom is when somebody complains of a headache. You know when you have a headache or not, but a headache cannot be measured by anyone else. So no one else can actually know that you have a headache because it can't be measured. Any question about a symptom? A sign, on the other hand, is a change in the body that can be measured or observed as a result of disease. So a sign is not subjective, it is an objective. And a very good sign would be when someone has a temperature of 102 degrees. Let's see, that's 102 degrees Fahrenheit. That can be measured. See the difference between a sign and a symptom. A syndrome is a specific group of signs and symptoms that characterize a disease. For example, the signs and symptoms characteristic of AIDS is a syndrome. Any question about any of that? A communicable disease is any disease that it can spread from one host to another. An example of a communicable disease, measles, tuberculosis, and chickenpox. A contagious disease is a disease that is easily spread from one patient to another. Can anyone name a contagious disease? A disease that easily spreads.
The cold.
The human cold is an example. COVID-19 and measles are another example. So what's different between a communicable disease and a contagious disease?
Contagious is just more easily spread.
Yeah, contagious disease is one that is easily spread. So of these three diseases here, what disease is communicable but is not contagious? I already told you measles isn't the answer because that's a contagious disease. It's one of the most contagious diseases ever. So there's only two other choices. You have a 50% shot, even if you're just totally guessing. Which of these diseases spreads very easily and which does not?
Chickenpox does.
Chickenpox spreads very easily. That is correct. So chickenpox would be a contagious disease. Tuberculosis does not spread easily. To get tuberculosis, you have to be in close contact with someone with TB for an extended period of time. That doesn't mean you can't get it for a short period of time, but you're not likely to get it if you're exposed only to a short period of time. Any question about any of that? So TB or tuberculosis is a communicable disease, but it is not contagious. An even better example of a communicable disease is, oh, let me think about it. Drawing a blank here. In the Old Testament, they called it an unclean person. Oh, I almost had it. Tuberculosis. Um, oh gosh, it's not malaria. I'm drawing a blank here again. Just let me. Hansen's disease, which is more commonly called leprosy. So leprosy is a disease that is not easily spread. You need close contact for a long period of time before you have the possibility of getting the disease. And not only that, only about 10% of the population can come down with leprosy. Any questions about any of that? I guess while I'm talking about a few diseases, I should mention something about MRSA, multi-drug resistant Staphylococcus aureus. Does anyone know how that spread? Staphylococcus aureus, where does it grow when it
Uh,
causes
is
disease?
it spread through droplets?
Not usually. This is a disease that's usually spread from skin to skin contact. It does not cause disease for whatever reason in the nasal passages. It only tends to cause disease when it is on the skin. I mean, this is where it normally grows on the skin. It can cause diseases in other locations, like if you get a blood infection by Staphylococcus aureus. And multi-drug resistant Staphylococcus aureus, or MRSA, is primarily spread as a skin disease. It is easily spread, though, so you only need short contact. For example, I once explained that, well, I didn't get multi-drug resistant Staphylococcus aureus. I got Staphylococcus aureus from my aunt, and all she did was she hugged me. So that would be a short-term exposure. Only one time, as far as I know. I think we went into the hospital to see her, and so yeah, it wasn't like I went to her place and then would be having multiple possible exposures. It can be spread from somebody touching a surface and then you touching the surface as well. Am I sharing my screen here? Yeah, I am. So, to my knowledge, it's a contagious disease because it can spread easily. And one problem with that is it's showing up on some schools because some sports have a lot of physical contact. And this is a problem because if MRSA gets in the school, it could spread player to player. Now, obviously, it depends on contact sports. A sport like tennis, which isn't very contact sport, you would be unlikely to get MRSA from that. A non-communicable disease, and yet an infectious disease, is one that does not spread from one host to another. It is caused by a microbe, that's why it's an infectious disease, but it's non-communicable. For example, tetanus, when one patient gets it, it's not going to spread, at least most of the times, from one patient to another patient. I said from most of the times because there is one example where tetanus could spread from one patient to another. Can anyone ever think of why tetanus would spread from one patient to another? I guess there's two cases of that actually.
Could it be like exposure to the infected person's blood?
Um, Only if you had a wound and then the blood got in that wound and then there was tetanus in his blood. You could get tetanus that way. And that's true too. You could get tetanus if you, this is normally, well, let me think about that. Is it normally, it starts as a skin disease or an infectious disease of the lungs, but you could, no, it doesn't start from an infection of the lung. I'm thinking of another disease. This normally starts from shrapnel hitting a person in the war, and the tetanus, um, what is it? Endospore is in the ground or on feces, and the shrapnel gets into the patient, bringing the tetanus to the patient. The most likely case of tetanus spreading one patient to another is if a patient gets tetanus and then a cannibal were to eat that patient. Other than that, tetanus is non-communicable. You'd have to, like I said, have an open wound and then spread the tetanus bacteria or their wound into your wound, meaning you cannot get it through this the sealed skin, your normal skin. I don't think you can get it through your normal mucous membranes either. But shrapnel in war, for example, would be a good way to come down with tetanus, as well as consuming the endospore. You get it. The endospore can survive your stomach, and then it would germinate in your intestines. Why the cannibal is at risk. Any question about any of that? All right. Occurrence of disease. To understand the full scope of a disease, we need details about its occurrence. We can classify a disease on its occurrence as an incidence or a prevalence. Incidence is the fraction of a population that contracts a disease during a specific time period. The incidence is only looking at the new cases only. The prevalence of the disease is the fraction of a population having a specific disease at a given time, and the prevalence includes both the old cases and the new cases. For example, in the numbers of AIDS in the United States in 2007, the incidence of new patients in 2007 was 56,300 patients coming down with a new case of HIV or AIDS in 2007. But the prevalence in 2007 was 1,185,000 patients in the United States, being both new cases and old cases. Some diseases are normally stated by incidence, like I've never seen the flu reported by anything other than the incidence in the United States. And one reason why would because if you go the prevalence, about 100% of the population would have had the flu. Another disease which is almost always reported by prevalence, at least it used to be, I'm not sure if that's still the case, is COVID-19. At least when the epidemic was going out, the numbers stated about COVID-19 were always the prevalence. That may not be true anymore. They may have switched that over to the incidence, talking about only the current cases in the United States at the moment. Any question about any of that? Few more terms discussing the occurrence of a disease. A sporadic disease is a disease that occurs only occasionally in a population. For example, typhoid fever in the United States is usually called a sporadic disease because it happens occasionally at low numbers in the United States. An endemic disease is a disease that is constantly present in a population. Like the human cold, you can get the human cold all year round. It is more prevalent in the winter time and the cold fall and the cold spring. Another example of an endemic disease is malaria, which is found in the tropics and the subtropics. Why? Because the malaria parasite is there, and then the mosquito, which spreads that parasite to humans, is also present in the tropics and the subtropics. Any question about an endemic disease? An epidemic is a disease acquired by many hosts in a given short area in a short period of time. An epidemic is usually one continent. It might only be one area of one continent. For example, in 2019, COVID-19 first made its appearance in China, and it was an epidemic in China. That disease then spread outside of China and shortly became worldwide. A pandemic is a disease which is essentially worldwide or will become worldwide. Strictly speaking, a pandemic is when more than one continent is involved, and a pandemic usually becomes worldwide. Influenza and AIDS are or can be pandemics. I guess AIDS would be a pandemic because before about 1980, it was not even known to be a disease affecting the world, although they have evidence going back from at least 1950 that AIDS was a disease in Africa, spreading at fairly low numbers in Africa. I can actually state why AIDS and HIV spread mainly in Africa. And that is in Africa, they were using modern medicine, but they were not sterilizing the needles in between patients. So you go into the hospital and you needed an injection, they would give you an injection from a needle that was not sterilized. And the reason why the hospitals were doing this was to cut the cost of the medical expense of, I guess, first world medicine in Africa. And that made HIV spread in numbers from very, very low numbers in the 1950s to fairly high numbers in the 1980s. In the 1980s in Africa, most hospital patients in Africa, at least if they got a needle injection, came down with HIV positive patient. And then from there, it also spread worldwide. It got into what was it? The Haitian population, I think, as well as the gay population, and that's because of their sexual practices. And I think the Haitians also their blood practices. I think they were eating chicken blood or something like that. And I don't think it ever got into chickens, but for some reason, it got into the Haitian population very early on. And then it spread very rapidly in the United States. Any questions about pandemic, endemic, epidemic, sporadic diseases? Another useful way of defining the scope of a disease is in terms of its severity or duration. We can classify diseases in terms of their severity or duration. An acute disease is a disease where the symptoms develop rapidly, the disease is short-lived, and then the patient quickly recovers. The classic case of an acute disease is the human cold. A few days after obtaining the virus, you come down with signs and symptoms. The viral load becomes um, very heavy, very quickly, and then the virus load drops very quickly, and the patient quickly recovers. That's a very good example of an acute disease, the cold. However, the influenza is also an example of an acute disease. It's a much more severe disease, but it does tend to develop rapidly and go away quickly, although you might have it for a month. It does tend to go away. A chronic disease is a disease that develops slowly, persists for long periods of time, and usually gets worse with time. An example of a chronic disease is mononucleosis, hepatitis B, where you continually have inflammation of the liver. Mononucleosis is a different chronic disease because after a while you'll get very sick, but you will slowly recover. And then when you recover, the disease goes away. Hepatitis B patients, the disease, at least in some patients, does not ever go away. You just have recurrent inflammation of the liver, and your liver gets more and more damage. Sometimes that leads to liver cancer. Any questions between acute and a chronic disease? Let me state that there are some diseases which are in between an acute disease and a chronic disease. They're called subacute diseases. You don't need to know that because I'm not going to test you on a subacute disease. One example of a subacute disease is subacute sclerosing panencephalitis. I'm sure no one's ever heard of that, but it has disease symptoms in between acute disease and a chronic disease. Let's talk a little bit about the extent of the host involvement. Depending on how sick you'll become, can depend on the extent of your involvement, meaning the host involvement in the disease. Infections can be classified according to the extent to which the host body is affected. There's a local infection. This is where pathogens are limited to a small area of the body and usually the initial site of infection. Example of a local infection is a boil or an abscess on the skin, usually caused by Staphylococcus aureus, but it could be caused by some other skin infection. Any questions about a local infection? A systemic or generalized infection is an infection that occurs throughout the entire body. Example, when a child comes down with the measles or even the chickenpox, the disease spreads everywhere in the body. It's primarily manifested in the skin by the chickenpox signs and symptoms, but the patient will itch, and so obviously that involves the nerve, and it's usually breathed in, so the lungs are initially infected, and then the lungs carry it to the blood, and then the blood carries it to the rest of the body, and the blood carries it to the skin, and that's why the patient gets the rash of the skin. For chickenpox, you can exhale the virus, but you can also get it from contact with the lesion on the skin. I can tell you a story about that, by the way, and that is because children, when they got the chickenpox, it was a very mild disease, much more mild than if an adult got the chickenpox. And so before the vaccine, which happened sometime in the 1980s, parents used to have chickenpox parties. When one child got the chickenpox, they would invite the child's friends over for them to play with them. The idea being to expose the children to the chickenpox virus so that they could get chickenpox while they were young. And that way the disease would be mild, much milder than if you got the disease as an adult. Any questions about any of that? All right, there's also a focal infection. This is a systemic infection that began as a local infection. For example, MRSA that starts as a skin boil or skin infection can invade deeper into the body. And once it invades into the bloodstream can spread MRSA throughout the body. So that would be a focal infection. Any question about these different classification of the body's host involvement? Some other terms of the host involvement: bacteremia. This is presence of bacteria in the blood. Compare that to septicemia, which is growth of the bacteria in the blood. Most clinicians cannot determine whether the patient has septicemia, growth of bacteria in the blood, or bacteremia, presence of bacteria in the blood. So they usually use the term bacteremia when they find bacteria in the blood. But if you do a test and find that the bacteria are growing in the blood, that would be septicemia. Toxemia is presence of toxins in the blood. Viremia, presence of viruses in the blood. Any question about this? The extent of the host involvement does depend on the host's resistance to the infection, meaning the host can resist the infection, the immune system can respond. A primary infection is an acute infection that causes the initial illness. A secondary infection is an opportunistic infection that occurs after a primary infection. The primary is the predisposing factor which weakens the host defenses, allowing for other organisms to colonize and cause the secondary infection. For example, somebody who gets, a child who gets the cold can get an earache. The earache can then be caused by something other than the cold, and that's the secondary infection by other organisms which start growing in the middle ear. Trying to think of another example of an opportunistic infection. This is not a good example, but smokers, the smoking damages the mucous membranes of the respiratory system, and so smokers are more likely to get a respiratory infection. And it's simply because the smoking damages the mucous membranes, allowing a secondary infection. And smoking isn't the primary infection because it's not a disease. Well, not a microbe causing disease. But one example would be when you get the cold, you can damage your mucous membranes, and then you can get a secondary infection like a sinus infection where bacteria are now growing in your sinuses. There's also a subclinical disease. This is when the patient has no noticeable signs or symptoms. It's an inapparent infection. We've already talked about this, although we didn't call it a subclinical disease. We call it an asymptomatic disease. Some people can carry poliovirus and they never get the polio signs and symptoms. So we say they are asymptomatic or subclinical. And I've already mentioned this. Young people will be asymptomatic or subclinical when they have COVID-19. So they have a COVID-19 infection, but they don't know that they have the COVID-19 infection because they have no signs or symptoms. Apparently, COVID-19 is doing so little damage to the body, the patient has no signs or symptoms. The trouble is, this patient can then spread COVID-19 to someone else, like their grandparents, who COVID-19 could be a very serious disease to them. Any questions about primary infection, secondary infection, and subclinical disease? Let's talk a little bit about latent disease. A latent disease is where the patient has a period with no signs or symptoms. The pathogen is actually inactive. We talked a little bit about this before. Some viruses can go in the latent life cycle where they are not causing disease when they're in the latent life cycle. This is called a latent disease. The patient has no signs or symptoms of disease. The trouble is the patient can go out of the latent life cycle and then the disease will start showing up and they can become contagious. When they're currently in the latent disease, they are not contagious, they have no signs or symptoms, and the pathogen is actually inactive. A good example of that is the child gets the chicken pox and then the disease goes latent. That doesn't mean the disease causing organism disappears, it just goes latent, is not reproducing, not causing any signs or symptoms of disease, it's just hanging out. And then, usually decades later, the virus can come out and cause signs and symptoms of disease, meaning the virus has left latency and now causing disease. And with the chickenpox, the first time you get the disease is called chickenpox because of signs and symptoms. All other times you get that virus coming out and it's reproducing and causing disease, we call it the shingles. And usually the shingles grows down one area of the body that's innervated by one nerve hooked to the ganglia where the virus was hiding out. Any questions about any of that? Herd immunity is the entire purpose of vaccinating people. Let me blow this slide up. Initially, with COVID-19, there was fear that none of the people in the population were immunized to it because COVID-19 had never appeared before. And then when somebody got COVID-19, the fear was the majority of the people would come down with COVID-19 because nobody was immune to it. If, on the other hand, you've immunized the majority of the population, now when the few people come down with disease, these would be mostly non-immunized people, only people in very close proximity to the contagious people would come down with the disease. And the reason why the disease doesn't spread is because of herd immunity. The disease would have to go from, come on, mouse, this patient to that patient, from that patient to either that patient or that patient, and then from that patient to that or that patient to that patient. And these people are immunized, so the disease cannot take hold and grow in these people. So if you have enough of the population immunized, diseases do not spread. Any question about any of that? And that's because the immune people protect the non-immunized patients. With COVID-19, it is more than 85% of the population needs to be immunized before COVID-19 will stop spreading. United States will never get that high. The best we had might have been almost close to 70% shortly after COVID-19 just came out. But you need to get the new vaccine to be immunized, meaning the old initial vaccine no longer works on COVID-19. And it's probably higher than 85% because that's what it was initially when COVID-19 first came out, and each variant has spread at a greater and greater rate. So my guess is COVID-19 is now very close to you need 90% of the population immunized before COVID-19 will stop spreading. There is only one disease which we have greater than 90% of the population immunized at least most of the time. And that is with measles. Parents realize that measles is a fairly destructive disease when it hits their child. And so most parents are willing to get vaccinated to measles. And so about 90% of the children population in the United States is vaccinated to measles. And so most of the time, when measles pops up, it does not spread. However, the trouble is parents get a little bit worried or a little bit lazy, and that is they realize that measles hasn't been spreading lately. They don't get their child vaccinated. And what happens? Measles then shows up, and last winter, I think it was, it showed up in Texas and actually spread to about 3 other states because the percentage of immunized children was less than 90%. And you need 90% immunized to prevent the spread of measles. And so it was spreading, but primarily in Texas, but in something like 3 other states, or maybe it's a total of 3 states, 2 other states. Any question about any of that? And let me warn you, our current Secretary of Health, Kennedy, is not a fan of immunizations, and I would not go with his recommendations when it comes to vaccinating your children. Actually, Oregon, Washington, California, Hawaii, and I think Idaho have come together to make a vaccine recommendations because they do not trust the Center for Disease Control and the, what is it called? The Human Health, whatever the Human Health Organization is in Washington, D.C. But Kennedy is chair. Any question about any of that? Sorry, I went into the politics there. No offense to Kennedy. I just disagree with him on vaccines. And he's not really, well, he's not a doctor, so he shouldn't be Secretary of Health anyways. Patterns of disease. Normally, a specific sequence of events is associated with an infection by a microbe, and then the subsequent disease development. And the pattern is usually a reservoir must exist. A reservoir is where the disease-carrying organism comes from. The pathogen must be transmitted to a susceptible host. An immunized host is not susceptible, and so the pathogen cannot grow in the immunized host. The pathogen then invades the host and multiplies, and then the pathogen injures the host. If you don't have injury to the host, you have no signs or symptoms of disease. That doesn't mean the pathogen cannot grow in you, like with COVID-19 in young people. About 50% of the patients, the virus is growing in them. It's just not really injuring the host, at least not very much. And so the patient has no signs or symptoms of disease. But if it does injure the host, you will have signs and symptoms of disease. The illness will then end when either the host immune system destroys the pathogen or the pathogen kills the host. So those are the two possibilities. Any question about any of that? There are certain factors that can make the body more susceptible to and therefore affect the occurrence of disease. These we call predisposing factors. For example, females have a shorter urethra than males, and females have a much higher incidence of a urinary tract infection than males. There are inherited traits such as sickle cell anemia, which can make the patient more susceptible to getting a disease. So, sickle cell anemia patient is more likely to come down with a disease just because the pathogen is more likely to get established, grow in the patient, and then cause disease. Another example, which isn't really inherited, although it's partly inherited, is diabetics. Diabetics are more likely to come down with a disease than a non-diabetic. Climate and weather are well known to be predisposing factors. Everybody knows colds and flus are more likely to spread in the wintertime. It was initially thought that the reason why this was so, especially the flu, was because in the wintertime people came together, they stayed in their houses where it's nice and warm, they had the windows and the doors shut, so there wasn't recirculation of air, and then somebody would come down with a cold, cough in the house, spreading the disease. If you have air circulation when somebody coughs, the virus is, depending on what the air circulation is, if it's good circulation, the virus would be dissipated very quickly. But if you have a closed environment, like most of us in the wintertime, the virus can stay in your home for longer periods of time and it's more likely to spread. That is all true, but fairly recently they've discovered something else going on with the climate and the weather, and that is with the flu virus. The flu virus is actually stabilized by the cold weather. So the flu virus is longer to stay alive in the wintertime than it would be in the summertime just because of the temperature. The flu virus in the summer more quickly dies. The virus is unstable and I guess the membrane falls apart or something. And then another thing is in the summer, you have a stronger UV ray in the sunlight, and that's more likely to kill the flu virus than the weaker UV light of the wintertime. So these are all the reasons why, actually, we have the flu, which is more common in the wintertime than in the summertime. It's more than just everyone comes together and we have the house windows and doors shut. It's also the weather and the temperature actually stabilize the virus, and then the UV light is weaker, so the virus is less likely to be killed by exposure to sunlight. With the colds, I know that's the same thing with the UV light. I don't know if the cold virus can last longer in the wintertime than in the summer. It probably can. Just because the cooler something is, the less likely it's going to die. Fatigue is another factor that can predispose you to an illness. The more fatigued you are, the more likely you are to become ill. And this is a problem with students because a lot of you are either partying or studying a lot and you're not sleeping enough. And so you're becoming fatigued. So watch that. Don't become too fatigued. The age is a predisposing factor. Most diseases follow. Let me see if I can find it here. Yep, I had it for a while. There it is. Most diseases follow the, this is awfully slow. So the incidence as well as the number of infected particles on the y-axis, just time on the x-axis. Most diseases follow. Why did that die? This side sort of a curve, an inverse bell curve, and that is the older the patient is, the more likely they are to come down with the disease. The younger the patient is, the more likely they are to come down with the disease. COVID-19, I mentioned, does not follow that. COVID-19 is more like you do have some risk at very, very young ages, but then it drops very quickly down to very low. And then it becomes very risky at old age, much worse than even young age. Although, like I said, newborns, it's a problem in newborns, but I think even 1 year old, it's very low in children with COVID-19. Whereas this one, I don't know where this age is there, but something like around there is something like around age 55 to 65. Actually, I think 50 to 60 would probably be when it starts taking off and becoming serious. And the older you are, the worse the signs and symptoms of COVID-19. Lifestyle can affect your chance of getting a disease. I've already mentioned smokers are much more likely to get a respiratory disease, and it's just that the smoking damages the mucous membranes of the respiratory system. Any question about that? I could state further on lifestyle. Like people who are sexually active and more likely to have multiple sex partners are more likely to come down with a sexually transmitted disease, called the venereal disease now, and that's just because of their lifestyle. Assuming they're not using protection, obviously. Chemotherapy can also predispose the patient to an infection. People taking chemotherapy, it weakens their immune system. It can also damage the mucous membranes, probably not the skin, but the mucous membranes, making the patient more likely to come down with an infection. Any question about these predisposing factors? All right, let's move on to talking about development of disease. Once the host defenses are breached, disease development follows a certain sequence. This sequence tends to be similar for acute and chronic diseases. So first you have the incubation period. That's the period from or before the incubation period is before you get infected. The incubation period is once you get infected to the time when you first have signs or symptoms of disease. That's called the incubation period. No signs or symptoms, but you do have the disease-carrying organism in you, meaning you are infected. The prodromal period is the next period. This is the period where you have mild signs or symptoms of disease. Like when you say, am I coming down with a sore throat? And you have to stop and think about it. And you say, yeah, I'm coming down with a sore throat. I must be getting sick. That's the prodromal period. The period of illness is the period when your signs and symptoms are the most severe, and it's also when the number of organisms in the patient are the highest. The period of illness is followed by the period of decline. This is when the patient starts to feel better. Like when you have a fever, you're in the period of illness. When the fever breaks, you're now entered the period of decline. The signs and symptoms of disease decline. The number of infective organisms in the patient also decline. You have signs and symptoms all the time you're in the period of decline. Once your signs and symptoms disappear, you've entered the period of convalescence. This is when the number of infective agents in you reaches a threshold below which you no longer have any signs and symptoms of disease. And that's followed by, obviously, your recovery when you have no infective agents in your system. And that's not called a period because it's not a period of disease, it's when you're well. So even though you feel totally well in the period of convalescence, you're not totally well. You still have the disease-carrying organisms in you. They're just below a threshold number, so you have no signs or symptoms of disease. Now let me state a few things here, and that is some diseases are missing certain of the periods of illness. For example, I've gone around and I was in the incubation period for the flu, and then it felt like, I was just walking around, and then the next moment I noticed it feels like somebody hit me over the head with a sledgehammer. I went from the period of incubation directly to the period of illness. Sometimes when you have the flu, there is no prodromal period. And then sometimes with certain diseases, there is no period of decline or period of convalescence. In the old days, when a patient was HIV positive and became AIDS, an AIDS patient, they would enter the period of illness and then they would die. So the graph would be broken right there. They never, in the old days, before modern medicine, they would never enter a period of decline. Nowadays, with modern medicine, it is possible to administer the drugs, decrease the virus load on the patient, and then the patient will enter the period of decline. You can even enter the period of convalescence, but in this case, the virus never goes away, so the patient must always receive their medication to keep the HIV virus in the period of convalescence or the period of decline. And the patients have a lifespan that is similar to, just a little shorter than the normal lifespan. Any question about any of this? So you always have the incubation period. Oh, sometimes you don't have the period of illness, and that would be a patient who's asymptomatic. You go from the period of incubation directly to the period of convalescence. If you've ever had the human cold and you have the time to get lots of rest, I do this all the time when I used to come down with a cold. I haven't had a cold now for a long time because of COVID-19, teaching online. I always wear a mask when I go out in public, so I haven't had a cold for a long time. But it used to be when I came down with a cold, once I hit the prodromal period, I would get lots and lots of sleep. When you get lots of sleep, your immune system is working at its best and it would attack the illness. And I would go from the prodromal period to the period of convalescence, meaning I would decrease the number of organisms in me below the threshold, and then I would enter the period of convalescence. The problem is, many times I would be thinking, oh, I'm over the cold, and then I wouldn't get enough sleep, and then the cold would come back on me, and I'd say, oh, geez, I got to get more rest. And this happened occasionally, several times. We'll enter the prodromal period, enter the period of convalescence, not get enough sleep, enter the prodromal period, get more sleep, enter the period of convalescence. This only works with the cold. I tried it with the flu. I think I've tried it several times with the flu, actually. And the flu, it never works. But with the human cold, at least many times, I don't know if all times, but at least many times, you can go from the incubation period or the prodromal period to the period of convalescence simply by getting enough sleep. Any questions about any of that? No questions? Well, here's a question for you. In what period here are you not contagious or not communicable, I guess I should say? What period are you not communicable?
I think in the illness.
You think you're not communicable when you're most ill, the period of illness? That's the first time I heard someone say that. No, that's not correct. Do you want to take another guess? When you have a cold,
Convalescence.
convalescence would be a good guess. Another guess that people have is the incubation period. In actuality, you have the disease carrying organism in you during all of these periods. So you are communicable during all of these periods of illness. My mother used to frequently tell me, oh, I'm getting better now, so I'm no longer contagious. And I would tell her, Mother, you're speaking to a microbiologist. I know better. Even in the period of convalescence where you have no signs or symptoms, you still have disease-carrying organisms, you can spread disease. In the incubation period, you have the disease-carrying organism in you, you can communicate those diseases. The exception is in the very, very first hours of incubation, when you first are infected and before the virus or the microbe has reproduced, you might not be contagious in the very first couple of hours of incubation period. And that's just because the microbes are growing in you and the newly replicated microbes have not formed yet. And I don't know how long it would take a virus to replicate, probably not very long. But once you get the virus replicated and released from your cells, you would become communicable in the incubation period. For some common diseases, like colds and flus, at least of adults, they are most contagious in the late incubation period and the prodromal period. So colds and flus, at least for adults, you're most contagious late in the incubation period and in the prodromal period. Why are you more contagious in the prodromal and late incubation period than the period of illness when you have more number of disease-carrying microbes in the period of illness? It's because of the adult's immune system. By the time you reach the period of illness, your immune system can respond to the illness. And in an adult, the immune system will hit the microbes in the period of illness and then make the microbes, at least common diseases like colds and flus, make them less communicable then in the prodromal period or the late in the incubation period, when the immune system has not had enough time to ramp up a response against the illness. This only happens for adults. If you want to know, children are most contagious in the period of illness, and that's because children are not, well, their immune system isn't immediately attacking the microbes, and it's thought this dates back to our caveman ancestry, where the adults were trying to protect their children from getting the disease that the adult was carrying. So the immune system is hitting the microbes in the period of illness, making the adult less communicable in the period of illness than in the prodromal and late incubation period. And apparently, children did not care whether they spread the disease to their adult, or maybe their immune system isn't just developed enough. Although in late childhood, they should be, their immune system should be developed enough. But their immune system does not respond the same. And so children are most communicable in the period of illness for common diseases like colds and the flu. Any question about any of that? And that's a trick question. When are you most or not likely to spread disease? I won't ask any trick questions like that on an exam. Meaning that question was designed for you to fail, and the correct answer is at no point in the stages of disease are you not communicable, because you always have the disease-carrying organism in you. And so therefore you are communicable. Let's talk briefly about the spread of an infection. A spread of infection must come from a reservoir. That is the continual source of disease-carrying organism. Reservoirs can be living or non-living. For human diseases, humans are major reservoirs of disease. For some diseases like AIDS and gonorrhea, humans are the primary, if not the only, source of the disease-carrying organism. Carriers may have inapparent infections, meaning an asymptomatic disease, and there can be examples of latent disease where somebody is carrying the disease. They're not capable of spreading it in the latent disease, but they can come out of latency and then they can spread it. There are also animal reservoirs. I think some people know that you can get the flu from your dog and your cat. Most of the time, you won't get it from the dog and the cat. There's only a few cases, meaning a flu, variants of the flu, which come from cats and dogs. But the flu can come from horses and pigs and a bunch of other animals too. So there are animal reservoirs. For some diseases like rabies and Lyme disease, the disease can only come from an animal. These we call zoonoses. Some zoonoses can be transmitted to humans. An animal disease that can be transmitted to humans is called a zoonosis. If you don't know, rabies is a disease that when one patient gets it, they cannot spread it to another human patient. The reason is rabies in people does not spread to the salivary glands, and so even if a patient were to bite another human, the rabies would not spread human to human. And in dogs and most other animals, rabies will grow in the organism, grow in the brain of the animal, and it will also grow in the salivary gland. And then when the animal bites you, the rabies virus can be transmitted by the saliva. But rabies cannot be transmitted human to human. Any question about any of that? There are also non-living reservoirs. Example, botulism from canned food, tetanus from usually getting a puncture wound or from shrapnel. There's also examples where people get gastroenteritis from eating lettuce. The lettuce is picked, so they're calling it non-living. Because once you pick it, it really is essentially dying. We don't eat dead lettuce, obviously, but it's dying, so they're calling it non-living. And you can get non-living reservoir from the soil, water, and obviously lettuce. Any question about any of this? If not, I'm going to stop here and we will continue with this next time. There is no lab today. I'll only be there for 15 minutes to answer any questions. All right. I'll see you later.